Hi, my name is Hannah Singleton, and I did my thesis project on tetanus. So the most common symptom of tetanus is lockjaw, and some other signs or symptoms is headaches, fever and sweating, seizures, jerking or staring, muscle spasms, muscle stiffness, changes in heart rate, or blood pressure. Early in the disease, the muscles of the jaw are affected, which prevents the mouth from opening, a condition known as lockjaw. In extreme cases, a condition called opisthottonos can occur, which is the back muscle spasms causing, which is the back muscles with that spasm causing the head and heel to bow backwards. Gradually, other skeletal muscles become affected, including those involved in swallowing, and death can result from respiratory muscle spasms. The causative agent of tetanus is Clostridium tetani. It is a bacillus or rod-shaped bacteria. It's also an obligate anaerobe, which means it can only survive where there is no oxygen. It is also endospore-forming, gram-positive, and often found in soil contaminated with animal waste. Pathogenesis. The mechanism of tetanus infection is by the AB toxin system, where the B subunit acts as a receptor and binds to cell membranes. Then it delivers a second toxic molecule, subunit A, into the cytoplasm. Tetanus toxin, or TENT, is a bacterial protein toxin produced by Clostridium tetani. After entering the bloodstream, TNT binds to a receptor complex at the neuromuscular junction. From there, it's transported from the motor neurons into the spinal cord. In the spinal cord, TNT travels to inhibitory presynaptic terminals. In here, TNT destroys the vesicular synaptic membrane protein, otherwise known as VAMP. By destroying this protein, tetanus is able to inhibit the neurotransmission that allows the body to stop muscle activity. This is what then begins almost like a domino effect, where the rest of the motor neurons can easily be affected. By the spreading of tetanus toxins, involuntary muscle contractions can take place systematically, which means it will spread throughout the body. It can also internalize, which results in the localization of tetanus symptoms. Virulence factors. 2 to 14 days after inoculation, C. tetani produces two exotoxins, tetanolysin and tetanospasmin. Tetanospasmin is a neurotoxin that blocks the inhibitory nerve impulses by interfering with the release of neurotransmitters glycine and Y-aminobutyric acid. It enters the central nervous system and spreads through peripheral nerves or blood. It then blocks the relaxation pathway, resulting in characteristic muscle spasms and stiffness. Tetanolysin has a local necrotizing effect, which may facilitate the spread of C. tetani. Tetanospasmin inhibits the release of neurotransmitters approximately 2 to 14 days after inoculation. Transmission. The most common ways tetanus is facilitated is by puncture wounds, usually those involving a contaminated needle or a rusty nail. Another way tetanus can get into our bodies is by wounds that have been contaminated with dirt, feces, or saliva and are not disinfected properly. Bodily injuries caused by heavy pressure from objects or being squeezed in between two objects. Tetanus is also a non-communicable disease, meaning it can't be spread from one person to another. This is because C. tetani can only spread through direct access to the bloodstream. Epidemiology. So the first map I have here represents the number of new tetanus infections by world region in 2019. In the United States, tetanus infections are not common, with around 10 cases per year. However, 82% of new cases of tetanus originate in sub-Saharan Africa and South Asia. The second map represents the number of deaths from tetanus per 100,000 individuals. The mortality rate of tetanus in the US has basically been diminished with common administration of the DTaP vaccine. Worldwide, there's an estimated 1 million cases of tetanus per year, and the mortality rate can be up to 50% in some countries. 77% of all deaths from tetanus occurred in sub-Saharan Africa and South Asia in 2019. Around half of tetanus cases and deaths occur in the world's neonatal population. This is due to infected umbilical cords. In some developing countries, it is common that the severed umbilical cords of newborns are dressed with clay, soil, or even cow dung. So, culture and diagnosis. We currently have no lab tests that can confirm tetanus. The diagnosis is generally based on a physical examination and evaluation of patient history. An assay for antitoxin levels can be used that can help to confirm that a patient does not have tetanus. If the serum of the antitoxin level is at a level of 0.01 international units per millimeter or higher, the possibility that this patient has tetanus is not likely. The spatula test is another test performed in a clinical setting that shows high specificity and sensitivity for diagnosing tetanus. This test uses a small tipped instrument to touch the back of a person's throat. If the patient exerts an involuntary jaw contraction rather than the typical gag reflex, this suggests a positive sign of tetanus. Prevention. As you might know, the best method of prevention for tetanus is getting a DTaP vaccine. The DTaP vaccine provides an active immunity against three conditions: diphtheria, tetanus, and acellular pertussis. It contains inactive diphtheria and tetanus toxins. These are commonly known as toxoids. It also contains the Bordetella pertussis cell fragments. Generally, the DTaP vaccine is administered to children up to 6 years old, and then a booster is recommended every 10 years. Treatment. Immediately, patients who have tetanus must have their wounds cleared of any foreign objects. Any damaged tissue should also be removed to prevent the spread and development of tetanus. This is the most effective way of preventing complications of tetanus, as if it's completed urgently, then the risk of tetanus developing can be significantly lessened. The antibiotics metronidazole or penicillin are administered intravenously for a duration of 7 to 10 days. This is done using a needle or a catheter that has access to the veins. The IV needle is commonly injected through the veins of the hands or arms. Human tetanus immune globulin is used to help neutralize the tetanus toxins that are bound to muscles. HTIG, human tetanus immune globulin, is also administered with an IV with a single dose. To help control muscle spasms, benzodiazepines and sedatives can be given through the IV. An example of this is diazepam, which is normally used as a sedative. Magnesium sulfate has also been proven as an effective addition to medications as it helps to reduce muscle spasms by blocking synapses in the neuromuscular pathway. Magnesium sulfate also significantly reduces the requirement for the use of other drugs. And that is it. Thank you.